Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters with the Islamic Medical Association, a comprehensive chat. Today, we've got Professor Talib Abdool-Carrim, and we are going to be discussing vascular disease. Before we start, as is customary, I'm going to give some advices from an Islamic perspective, a small tarbiyah. Since we are discussing vascular disease, I think it will be appropriate to discuss one of the things which has become really a great evil in our society, and that is smoking. So many of you may say, how can smoking be a great evil, surely it can't be as bad as some other evils, and you may be right. But Allah subhanahu wa ta'ala has told us in the Quran, وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّحْسُنَةِ وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ. Do not harm yourself, do not take yourself towards destruction and ruin. So it is very clear from Allah subhanahu wa ta'ala that we should not expose our bodies to any harm, any form of harm voluntarily and willingly. In fact, we are told at various places inside the Quran that we should enjoin good and forbid what is evil. And surely there can be nothing more evil than a poison which you ingest, which slowly and consistently causes damage to yourself. And not only causes damage to yourself, but causes damage to those around you and to the environment. And in the past, there have been many differing opinions and fatwa around this particular habit. But in more recent times, as the harms and damages of smoking have become much more evident, there's consensus among ulama all over the world, really, that smoking is forbidden and harmful, and that it should be avoided. In fact, there are some ulama who have gone so far as to say that smoking is a major sin, although there is a difference of opinion on that matter. So I think it would be wise of us to look at this habit, to see how we can consistently try to avoid it ourselves, as well as try and get our families to avoid it. And some of the reasons why we should be avoiding it will be expounded tonight in our discussion with Professor Abdool-Carrim. Assalamu alaikum wa rahmatullahi wa barakatuh, Professor.
Wa alaikum salam, Shoayb. Pleasure to be here.
Jazakallah khair. As I mentioned, our topic is vascular disease, and maybe later in the program you can explain to us how smoking comes in and can cause a vascular disease. But just let's get a bit of background about what vascular disease entails, or what the blood vessels of the body do. And maybe you can give us a background of how blood gets pumped around our body.
Basically, your main organ is your heart, right, which pumps the blood, and the heart then sends oxygenated blood through the arteries to the organs and to the various body parts, the hands, the legs, the brain, and all the other organs in the body. And then this blood the oxygen gets taken up and then brought back to the heart through the venous system. Now, the interesting thing with the venous system is they've got valves in them. So it allows blood to go from bottom to top and not backwards. And, Allah Ta'ala has designed the system so beautifully. And unfortunately, there are certain diseases and problems that can affect the venous system, where the valves get destroyed, and we can talk about that later. But basically, this is what happens. Your arteries take the blood, oxygenated blood. The veins take this deoxygenated blood back to the heart. They go down to the lungs, get oxygenated, and come back to the heart.
So the blood is really like the main highway in your body.
Yes.
It carries the oxygen, it carries the food and the nutrients around.
That's correct.
It carries cells from different areas of the body to another. For example, cells which fight against infection, antibodies which may be responsible for preventing disease, and so forth and so on. And to get there, it needs the roads. The roads must be open.
Now, the roads get blocked because of the various diseases that enter into these vessels. And specifically, for example, in the arteries, you get smoking, damages the inside layer of the arteries.
And so these are just not pipes. They've got special
layers,
linings.
very living cells, literally. And these are then affected by various diseases. Cholesterol deposits in the artery and then damages the artery. And you get the narrowing of the artery. It sometimes cracks the artery open. And then you can get blockage. And in the venous system, if you get clots in the veins, these damage the valves. And then the valves get damaged. In the long term, you get problems with leg swelling
they can't
and leg
drain
ulcers.
back to the heart.
Yes, and so the blood can't get back and you get a lot of leg swelling.
Okay.
So the system is very intricate, but unfortunately there are diseases that will alter this beautiful intricacy in the body.
So, alhamdulillah, when people are born, most of them, as they grow up, these veins are clear, completely wide open.
Clean.
They're in good physical shape. But as time goes on, because of various reasons,
in fact,
they may develop different
problems.
diseases.
But we actually, in young kids, with the obesity that's now hitting us, and the bad foods that we're eating, we're actually seeing the arterial disease already in stages of puberty.
That's amazing.
So the disease pattern is already being set at an early stage now, which is very worrying, because if obesity and diabetes comes into the system, it affects the arteries even more. So it's really a major problem.
Prof, what would you say are the biggest risk factors now for vascular? Let's talk about, I think let's separate it, the arteries and the veins. So the arteries are the blood vessels which take blood away from the heart towards your tissues. And the veins in general are taking it from your tissues back to the heart. So let's start off with the arteries. So in terms of the arterial disease that we see, what are the main risk factors?
The main risk factors are high blood pressure, diabetes, smoking. There's also some association with gout, causing damage to the vessel because it's an inflammatory condition. Any inflammation can affect the arterial system. Even rheumatoid arthritis, for example, very high inflammatory disease.
The higher risk of
vascular disease there as well. So we're seeing all that now. And in fact, if you look at it, it's really inflammation that affects the wall of the arteries. And that causes the damage. So, as I said, the main risk factors are high blood pressure, diabetes, smoking, high cholesterol level, if maybe familial or if it's something acquired by us, wrong food eating and wrong habits. But certainly those are the conditions that quite commonly affect
and they put you at risk of developing.
And they definitely put you at risk.
Disease. You mentioned that there is a genetic element as well.
Yes, you do get for example, in our environment, we've got a lot of the Afrikaner population that has got familial hypercholesterolemia. They have cholesterols of 20, 25. And they get their arterial disease very early in the 20s. So there are some genetic causes, but majority are all acquired. Hypertension obviously now is a genetic cause, and certainly is another cause for damaging the arterial wall because of the high pressure hitting the arterial wall.
And from a medical side, when you're looking at a patient to assess whether they have arterial disease, what would you usually be doing?
Essentially, it's a clinical examination and a history. The history, usually if they've got arterial disease, they will complain of pain, for example, when they walk. With the heart, you'll get angina when you exercise. So when you exercise, when you walk, there's increased demands for oxygen. And then these demands don't get met and you get pain. So it's if the artery is narrowed.
So it depends where the artery is situated. That's where you get the pain.
That's where you'll get the pain. So you can get anginal pain in the stomach too. So if your arteries of the stomach are blocked.
And that you'll get when you're eating.
Yes.
Because that's when your stomach's doing more work. And so similarly, when your legs are doing more work and you're walking, if the arteries going to the legs are blocked,
then you will get
pain in your legs. So and then you obviously look for the pulses or signs.
And then clinically you feel for pulses. For example, in your hand, the wrist level, you got the radial pulse, and we usually feel for that pulse. We would feel for all the other pulses that we can feel in the neck arteries, in the upper limbs, in the lower limbs, in the legs. You can feel the arteries. So if you don't have pulses present, and you give the correct history of pain on walking, and you don't have pulses, then we usually diagnose peripheral arterial disease. And then there is other tests we can do to just look at the pulse status. So we compare the upper limb, which is less prone to arterial disease, as compared to the legs, and we take a pressure difference in the two. So you take the pressure in the arm and you take a pressure in the foot,
Okay.
and you take the ratio.
Your ratio. Okay.
So it's ankle over the brachial. Brachial is the arm,
okay.
and it's called an index.
Yeah.
Normally in you and me, it will be 1 if our arteries are normal.
Right, because it means it's equal in,
Equal,
in both
yeah.
of them. Yeah.
But if there's arterial disease, anything under 0.9
okay.
is going to be abnormal.
Okay, because you would expect the pressure to be a little bit higher in the legs because
Yes,
of gravity.
gravity,
So
but usually
it's about the same.
About the
yeah.
same.
So if it's less than 0.9, it may mean that the arteries in the legs
are problematic.
Are becoming blocked. Just to remind viewers, if you want to call in, if you have questions for Professor Karim related to vascular disease, if you feel that you may have some symptoms of vascular disease, you want clarity on how to treat vascular disease, including arterial disease or venous disease, conditions like peripheral vascular disease, varicose veins, deep venous thrombosis, those are the type of things which we will be discussing tonight. The number to call is 011-086-7701. So that's 011-086-7701 or 2 or 3, and the numbers will be up on the screen as well. So Prof, just to get back to what we were discussing, you know, we mentioned there are certain specific names of arterial disease in the heart. For example, you get a heart attack or myocardial infarction. When it affects the brain, it's often a stroke.
It's a stroke, or you get a symptom which is very typical of stroke.
Right.
But it doesn't last longer than 24 hours. It's called a transient ischemic attack.
Right.
You suddenly get blindness in the eye, or you get sudden weakness in the arm or leg, or your face goes funny,
but just for
your speech. Period. But it's short period, under 24 hours.
Right.
Stroke is where you get an established clot going to the brain and causing damage to the brain.
Right.
So you've actually got what we call an infarct.
Right.
Where the tissue dies, the brain dies.
Because it hasn't received
blood for long enough.
So the first one, it hasn't received blood for a little while,
but
and then the blood supply came back.
Yeah, and it's too tiny a clot, so it doesn't.
But that's a warning sign that you're going to get a stroke.
Very strong warning sign that you might be getting a stroke.
Okay, okay. And then what type of investigations do people with vascular disease get, including
basically, we can do ultrasound, which is the simplest and easiest to do, but obviously it must be done by somebody who knows what they're doing, because ultrasound is very operator dependent. But essentially we can map the arteries right down from the stomach right down to the legs and see exactly what's happening. And even better is the arteries.
We'll come back to this.
Yes.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam. How are you?
Alhamdulillah.
Alhamdulillah.
You know, this topic is very important for my family and for myself, because we've got hypertension as a hereditary disease in the family.
Okay. What's your name, brother?
Are you speaking to Tahir?
Okay, Tahir. How can we help you?
Okay. I've actually been suffering with this for the last 5 years or so.
Gee.
But what happened is, over the last few months, my blood pressure has picked up tremendously. So if it averages between 190 and 203. Now, I've been to a few doctors and a cardiologist as well, but they feel that I'm too young to go onto medication. So they actually put me on a monitor, and they wanted to test it over a 24-hour period.
Yes.
But now, I need to know what kind of home remedies will actually bring my pressure down, because it's actually getting worse over time.
How old are you, Brother Tahir?
I'm 31.
Okay. I mean, this is not specifically about vascular disease, but hypertension is probably related to your blood vessels. And there are causes of hypertension which can be related to vascular disease. But Tahir, you mentioned that hypertension in your family is hereditary. How do you know that? Does everybody in your family have high blood pressure?
My late dad had hypertension, my grandmother, my grandfather.
And how old were they when they started with high blood pressure?
Young ages, in the 30s and 40s.
Okay. You are right. There is a component of the population that will have high blood pressure at a young age, and it may be hereditary as well. But there is also, if you develop hypertension, usually under the age of 35 or so, there's a risk that you may have what we call secondary hypertension. That means it may be related to another underlying condition, like vascular problem, like hormonal problem, and so forth. And you are actually right, the doctors are wrong. You're not too young to have hypertension. And at that degree of hypertension, 190 or 200 systolic, actually they shouldn't wait. You need to be on treatment immediately. You need to go back to your doctors and tell them that they need to treat you immediately and investigate as to why your blood pressure may be so high. It is vaguely and rarely possible that you can have what we call white coat hypertension, where you only get a high blood pressure because of anxiety and so forth. But it's unusual for it to be that high, to be honest. So I think if your blood pressure has been, even on more than one occasion, has been that high, you need to be on some type of therapy, but you also need to be investigated to see if there's any underlying cause. And one of the causes is a vascular problem. It's where your blood vessels to your renal arteries, your kidneys are blocked. And it's actually not that rare. When looked for, it may occur in up to 2 or 3% of the population of hypertensive.
Tahir's other question was home remedy.
Yes,
I think the one thing is if you're a smoker, you need to stop.
That's right. Yes.
And secondly, cutting down your salt will also help.
So it's not so much what you can take; it's more what you don't take. So avoiding a lot of salt, not smoking, and then the one other thing you can do is increase exercise. But I wouldn't do that if your blood pressure is very high. It needs to be controlled first. And whether there's any other, home remedies which have been proven, there's not that much evidence for them. And I think at the moment you're probably better off going and getting some medication for that blood pressure problem type.
And this would be obviously chronic medication. It would be for life.
If there's a secondary cause and it's something which can be treated and cured, then sometimes you don't need medication for life. So that's why it needs to be investigated to see if there is a secondary cause. It can be a sign of kidney disease, it can be a sign of vascular disease, it can be a hormonal issue. So there's quite a lot of issues which can cause hypertension.
Not to keep you for too long, but I've also been suffering with nosebleed continuously over like 4 to 5 day period. The nose doesn't stop bleeding from both nostrils.
Yeah, I think you should go and see your doctor. It may be related to hypertension.
Okay.
Jazakallah. Okay, Jazakallah. Okay, Talib, so that was a bit off the topic, but maybe it can bring us to what some of the complications of vascular disease are, but we'll come to that. We were discussing how you image and find out, investigate.
The simplest and the easiest image for what we call carotid artery disease, which gives you the TIAs and the stroke. One of the common causes, not an uncommon cause, is narrowing of your arteries in the neck.
In the neck. Oh,
and
we've got another caller.
Yes. Okay.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Hi, good day. Can you hear me?
We can hear you, yes.
We can hear you.
Okay, it's Randy speaking from Durban.
Yes.
And what I need to know, I had a similar problem 3 months ago. I didn't have a full stroke. I had a problem with my brain, and I went for an MRI scan. But the problem is, from that time to now, I don't have any taste in my mouth, and at certain times my speech is very slurred.
Yes. I mean, that really sounds like you've got established stroke, not just a TIA, and that can typically cause that type of symptom. But obviously, if you have had a stroke, there's a risk that you could get another one. So I'm sure your doctors have looked at what the causes are. Prof, maybe you can elaborate what should be done if you've had a stroke.
Certainly.
Okay, but and the question I need to know is, why is it like taking 3 months for me to get my taste back?
Okay.
It takes a long time, firstly, for brain tissue to recover, if it does recover at all sometimes. It doesn't always recover. But there is no doubt that you need to check up why you got the stroke. How old are you, if I may ask you?
I'm 53 years old.
You're very young to have a stroke. So whether you've got risk factors like high blood pressure, diabetes, smoking, those need to be addressed fairly quickly. And also we need to find out why you developed the stroke. It can be many other causes, as we were discussing earlier. The one cause is narrowing of the arteries in the neck. The other could be clots from the heart going to the brain. The third cause could be bleeding into the brain.
Sorry, they did say bleeding in the brain.
So that most likely, maybe do you have high blood pressure?
Yes, I am.
That's most likely the cause is usually uncontrolled high blood pressure can give you bleeds, which is the commonest cause in our environment actually.
Strokes,
So, but you need to have your blood pressure well controlled, brother.
And then they should check your cholesterol and other things like that.
And also if you're diabetic, that's another cause for strokes.
Yes, and sorry, one more question. Why is it like certain times my speech gets slurred?
That's because it's affected the left side of your brain usually. That's where the speech center is. And that because you lose the brain cells in that area, your speech will be affected.
You may find it's worse at some times than others, because what happens when you get a stroke is your brain has to form new connections. And those connections are not as efficient as your old connections. So sometimes if you're tired or you're under a little bit of stress, even people with other types of stroke will say that at sometimes when they have a lot of pain, they have an infection, they're tired, they're under stress in some other way, their symptoms seem worse than at other times. So the idea is to try and prevent you from having more strokes, because if you do, then obviously you may end up with more and more deficits, and it could even be fatal. Okay.
No. Thank you, doctor. Thanks very much.
Okay, thanks, Dandy. Prof, we don't have much more time to discuss. We're going to go for an ad break now, inshallah, and then we'll come back after the ad break and go on to what we were discussing around imaging, and then we'll take it from there, inshallah. Okay. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to Health Matters with the Islamic Medical Association. We have Professor Talib Abdool-Carrim, and we are discussing vascular disease and conditions which affect the blood vessels. We were discussing how you diagnose vascular disease and what type of imaging you use. And Prof, you mentioned ultrasound.
Yeah, as I said, Shoayb, the first test today we would do is an ultrasound, and that gives us a picture image of the arterial wall. We can see what the arterial wall looks like. We can see venous wall. We can see what the venous function is. So in vascular disease today, the first test would be an ultrasound.
Right.
If we decide, we're going to consider doing some further operation or we need to investigate, then we would go on to more invasive tests, which is basically an angiogram. And an angiogram is really a roadmap of the arterial system. It gives you a direction of where the arteries are, what's blocked in the arteries, how badly is it blocked, and if it's blocked, what can we offer the patient in terms of surgery.
We're gonna put some pictures up now. Some of them are a little bit graphic, so sensitive viewers may want to be careful. These pictures are of patients who have severe vascular disease of their limbs, and this is the type of person who is a diabetic, maybe a smoker for many years, hypertensive, who's developed vascular disease, and the vessels have become blocked.
Yes.
And that's the type of patient who may need a procedure done then to unblock the vessels.
The picture that's just come up basically is a patient who has got a very pale looking foot.
Right.
And this was an acute arterial blockage.
Right.
And what he had was a clot from the heart went down the leg.
Right.
And he was in extreme pain. We had to operate on him immediately to get the clot out of the artery. And that comes around sometimes from your heart. Basically, the pulse rhythm goes abnormal, and you form a clot in the heart and then throw the clot to the arterial system.
It breaks off from the heart.
So it breaks off from the heart and goes down
to the vessels and blocks when it can't fit anymore.
And essentially, it breaks up wherever the arteries are breaking up into twos.
Right.
And the common sites are in the leg, or it may be in the abdominal aorta, where it breaks up into going to the two limbs.
I think that's because obviously it's the most direct way.
Yes.
The other arteries come off at a bit of an angle.
So it doesn't tackle them much. But sometimes you even get an acute stroke from a clot from the heart. So
and that's called an embolus.
Yes. And that's an acute emergency.
Yes.
So we do deal with acute emergencies.
And you would lose the leg if that's not fixed up.
You can lose the leg if it's not appropriately treated.
And the second picture has come up now.
The second picture is a diabetic foot, and the reason I put this up is actually if you look at the foot, look at the structural anatomy.
Right.
If you look at it, the toes are clawed.
Right.
The arch is very high arch, and the foot, the metatarsal head, is actually almost gone abnormal.
And this has been from someone who hasn't had blood for a long time.
Not only blood flow, but this is also due to diabetes causing neuropathy, where the nerves are damaged because of both the arterial disease in the small vessels in the nerves, but also in the bigger nerves. So diabetes per se gives you both arterial and neural problems.
And that's where the danger is, because they may not feel the pain.
Yes, they don't feel pain. They walk around barefoot. I've had patients who've put their foot into hot water and got third-degree burns.
And they don't know that they
don't
burnt
know
it all until somebody looks at it.
Yes. So it's a real problem with diabetics, and that's why with diabetics you always are a bit more careful in advising them about foot care and about wearing proper shoes and not walking barefoot, not putting hot water bottles. It's winter now.
Yes.
People put hot water bottles, they put the foot right near the fireplace or near the heater, and they get burnt without realizing.
Yeah.
So it's very important. Also, for example, a simple thing like cutting a nail. You can cut your nail right through because you can't feel it. And diabetics also get small vessel disease in their eyes.
So they can't see.
So they can't see. So they will cut the skin off instead of cutting the nail. And we always inform them that they must get their life partner or somebody in the family to help them cut their nails and look after their feet. In fact, they must inspect their foot almost every day.
Yes, yes.
So that they don't see any ulceration or any callosities where there's too much pressure. Because that's how
so
the damage
diabetic foot
happens.
is a huge problem.
Huge problem.
How often would you recommend a diabetic looks and sees a podiatrist?
At least twice a year, minimum twice a year.
Okay.
The more you see him, the better, because he can then pick up problems in your foot. They can map out your foot pressures. They can then give you insoles and inserts that will help you improve your pressure points, and you can avoid ulceration. And in fact, if you look at the UK has half the amputation rates in diabetics by just having good diabetic clinics.
Oh, that's fantastic.
Where there's a podiatrist, there's a
so
physician.
somebody's looking,
so
giving
somebody's
advice all
giving
the
them
time.
advice all the time. I always tell my students that the first thing you do when you see a diabetic is advise him about his foot care.
Yeah.
Because 50% of diabetics will have lost a limb or a toe within their lifespan.
That's unbelievable. We've got the next picture here. We'll come to these pictures maybe a bit later because they relate more to venous disease.
Yes.
So maybe let's take a call because I believe we have some callers on the line. Okay, let me just remind callers about the number. It's 011 086 7701 or 086 7702. Let's go back to venous disease, Prof. So we talked a lot about the arteries, we talked about the risk factors. What are the main risk factors for venous disease?
Venous disease, if I can just give you first the anatomy,
yeah.
It makes it easier to understand. You've got a superficial system.
Right.
And you've got a deep system.
Right.
Now, both the superficial and the deep system runs with the muscles.
Right.
The superficial system is the veins that we see in our legs, under the skin.
Okay.
Both of them have got valves.
Right.
And both have, the superficial system joins the deep system at two major points.
Okay, I think we've got the caller back. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam.
Welcome, sister. How can we help you, sister? Hello?
Hello?
I think the line is very bad, sister. Maybe you can put the call down and call us back again, and maybe we'll be able to hear you because we can't hear anything that you're saying at the moment. So maybe we can just go back and discuss the venous.
Yeah. So as I said, there's two sites where the superficial meets the deep. One is in the groin and one is behind the knee.
That's in the legs.
That's in the legs.
And the legs really the system which is at risk.
Yes.
Because
the reason for that is the gravity.
Yeah.
We've got to stand. If you see four-legged animals, don't get varicose veins. But we are two-legged animals and we get varicose veins. So people like teachers who stand for long periods of time, surgeons who stand for long periods operating, will all get in long-term varicose veins.
Okay.
It's just the pressure generated on the leg veins.
Okay.
And veins are thin walls, so they dilate up, and when they dilate up, the valves get separated. And so you get varicosities.
Is there a genetic element to varicose veins?
There is a genetic element. We haven't worked out exactly what, but there's no doubt that if your parents had veins, you're going to get varicose veins.
Okay. And any medicines, there was some link between varicose veins and the pill and so forth and so on?
Yeah, there has been some, but again, it just gives rise to small spider veins, not so much the larger veins.
Okay.
But we do know pregnancy does initiate varicosities.
Because of the pressure in the pelvis.
Because of the abdominal pressure rises and you get valve damage through that.
Okay. We have a caller back on the line. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
How can we help you, brother?
I'm actually got pain on my lower legs, and I've had a lot of itching on my shin.
Right.
And then I've taken the tablet called Anti-Stax, And then the itching has gone away, but the lameness in my leg is on a continuous basis, all the time.
Yeah,
and I look, my legs actually feel tired. Has that got anything to do with vascular disease or what?
It may have, it depends.
Are you diabetic?
Are you diabetic? Yeah.
No, I'm not diabetic.
Okay, and do you have any back problems?
Yes, I have very slight.
It may be that your lameness is coming from the back, but obviously it's difficult to give you a diagnosis like this. Certainly I would have yourself checked up with your general practitioner to just examine your pulses, and if your pulses are normal and you haven't got varicose veins, the chances are that it's maybe coming from the spine, or it may be some other cause that's giving you this pain, but it needs to be looked at better.
I think there is quite the
other thing.
Yes,
the other thing is, like, I get pain on my foot, especially on my left foot, and it's right on the side where it's all the time there, and if I tramp a little bit hard on it, then it actually becomes acute.
It may be some underlying abnormality in your foot, musculature or bones. I would suggest you see an orthopedic surgeon first.
Yeah,
and then
I think if you have pain with pressure, that's much more likely to be a local thing.
Yes.
Like arthritis or a plantar fasciitis or one of those. Normally, the pain that you get with vascular disease is on activity. And it's not when you push your foot down, it usually comes in the muscle when you're walking. So it's like a cramp in the calf. More often than a cramp in the foot.
Yeah, it's more cramp in the calf.
And that type of pain is what you feel. But certainly if you've had back problems, I would advise that you see a doctor, let them examine it in detail and see where the underlying problem is. Jazakallah khair. I believe we have another caller online. Assalamu alaikum wa rahmatullahi wa barakatuh. Okay, so we have another caller online. Assalamu alaikum wa rahmatullahi wa barakatuh.
Okay, I'm calling you from Springs. I just want to find out, I have a small problem in my head. My head is actually getting a little bit weak.
We didn't hear that, brother. You said your hands get a little bit weak.
My head.
And what do you mean your head gets weak?
I mean, normally, I don't know. I never had a heart attack before. No, minor, I don't know how they call it. Whenever
Hello?
Yes, sir.
I said you have a headache.
No, my head, sorry.
Your heart?
My head is weak, yes, sir.
Okay. Your heart is getting weak.
Yes, sir.
Your hand, do you mean your hand, brother?
My heart.
Okay. Prof?
It's difficult to work out what you're trying to say, but I mean, if it's the heart, then we need to get you to see a cardiologist, possibly. I would suggest you go see your primary physician, your doctor or GP, and then let them assess you and take you further with that.
I mean, weakness, if you're saying you're getting weakness in your hand, certainly it could be a sign of a stroke, or it could be a sign of some type of disease affecting either the blood supply or the nerves to the hand.
Yeah.
So
but I'm not sure if it's the hand or the
heart. Because we can't hear you very well, brother. So I'm sorry about that. Maybe we can go back and discuss, we were discussing the venous system. So we've got another caller.
Okay.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Islam. You're speaking to Hafsa.
Yes, Hafsa. How can we help you?
I just wanted to find out, my husband had a heart attack last November, and because of lack of oxygen going to the brain, he's got brain damage. He's got hypoxia.
Yes.
And I wanted to find out, can it cause, by him being in a vegetative state, can it cause varicose veins?
If he's lying in bed, it's unlikely because your veins are very collapsed during the lying flat. It's only when you're upright that you can get varicose veins.
But you could get deep venous thrombosis.
Yes,
that's
if you're
another
constantly without movement.
So what happens? The blood doesn't flow very nicely in the veins because you're not moving. So you can get a clot which forms in the veins because of lack of movement.
Okay, but if he's like moved constantly, like turned around,
Yes,
then
that should prevent it.
That's very important to do that, and even massage his muscles so that you improve the venous flow.
Okay.
Okay. So, I mean, let's talk about deep venous thrombosis a bit, Prof.
Sure.
That's another complication. Obviously, the risk factors for DVT are quite different.
There's different risk factors. This is clots within the veins which come on. The deep veins. You can get superficial veins also getting thrombosis, and it's called superficial thrombophlebitis.
Right.
The deep veins, we call it deep vein thrombosis.
Right.
And essentially, you get it. There are, again, risk factors for clotting. The one has been the pill, for example, in the young people. Elderly people are more prone to clotting. But the reason for that is also the elderly people get more cancers.
Right.
And cancer today, we know, is a very
Makeshift
procoagulant state.
Right.
That means you get clots in your body because of cancer.
Right.
So it's very prominent.
We're not sure
now.
how that happens
We
exactly.
don't know how it happens, but we know the cancer cells stimulate some procoagulant in the blood, which makes the veins clot up, and even the arteries clot up.
Yes, yes.
So it's a very thrombotic state, cancer. Then you've got other factors that can cause clotting, and that is, for example, when you get a fracture and you put in a cast,
Right.
because your calf muscles are the main function in terms of venous flow.
And obviously, if you have surgery, your
Or
body
you've had surgery in the pelvis,
Yeah.
then again you can get clots. So over hip surgery, common. Knee surgery, common. We see it. So that's why
especially because your legs are incapacitated.
And
we've got another call on the line. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam, Sheikh.
How can we help you, brother?
Can I talk to the doctor? I actually got a problem on the background.
Yes, brother. What's your question?
My question is, I actually got a problem on my background. So what must I do?
On where? What do you have a problem on? Can you not listen on the TV and listen to us on the phone, brother?
And I said I got a problem on my background.
I can't understand.
I can't seem to work out what.
Understand it.
Sorry.
Okay, maybe call back and we'll have to discuss if we can understand what your problem is, brother. We're going to go for an ad break again, Prof. I'm sorry about that, but we'll get back to discussing the risk factors for deep venous thrombosis and some of the complications and how we treat that as well. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back once again. We were discussing vascular disease with Professor Talib Abdool-Carrim, and we have been discussing deep venous thrombosis and complications related to deep venous thrombosis. So we mentioned the risk factors. Yeah.
The risk factors, as I said, one is the elderly get it more because they get more sick, they lie more in bed, they're also more prone to cancers.
Right.
Then you see it in people who've had injuries
and surgery,
especially hip and pelvic surgery.
Right.
And then you see it in some individuals who've got an underlying clotting problem.
Yes.
Again, genetic causes coming.
Right.
And then the other...
people who are very obese at higher risk of
Obesity is also a risk factor now for deep vein thrombosis.
Okay.
There's no doubt about it, because the venous return is impaired because of the large size of the abdominal cavity. And so there's no doubt that obesity is a cause for DVT.
We've got another caller coming in. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. I am 47 years old, and I have varicose veins on my left leg, the protruding veins.
Right.
And doctors have said I need an operation. What I want to know is which method would be a better method to go for, the cut and strip or the laser?
Either one is, Assalamu alaikum, either one is just as effective. The one is laser. You can also get radio frequency ablation, where they put the probe, just like in the laser, into the vein and they burn it from the inside. And whereas the open surgery is where we go make cuts in the groin, we tie off all the branches of the vein, and then we strip the vein. Now that is a bit more gory and it's a bit more painful. but the end result is about the same with both. The only advantage with the new techniques, that is the laser and the radio frequency, is early return to work and less bruising.
And is there a cost difference?
There's a cost difference as well, yes.
So does medical aid fund?
Well, some medical aids are funding the laser and the radio frequency ablation.
Okay. So, I mean, I hope that answers your question, sister. Maybe you want to explore which is the most advantageous to you from your end. Jazakallah khair for that. So, as we were discussing, Prof.
Yeah, and the other two main causes, one is the phospholipid syndrome,
right,
where your own body starts reacting against yourself, and that can give you clotting both in the
arterial. So it's like an immune disorder.
Immune disorder.
And then you create more clots.
And the other condition is HIV, which has hit us very hectically. And that also causes arterial and venous thrombosis spontaneously. So those are the usual risk factors for DVT. Some people say that flying is also, but flying, I would put it down as being incapacitated for a number of hours, long hours, sitting in particular positions.
But certainly if you've had a DVT before,
then you
must go on a long flight,
you must take precautions for that.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. I believe we have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh. Yes.
Wa alaikum salam wa rahmatullahi wa barakatuh. How are you?
Alhamdulillah.
My name is Talib.
There's a very poor connection once more, sister.
Very poor connection.
Maybe call back, sister. We can't hear you at all. I'm not sure if it's the same sister who tried to call earlier. But we can't hear you at all. Prof, one of the big problems with deep venous thrombosis is that those clots can obviously break loose. And
they can go to the lung, and you get a condition called pulmonary embolism.
And that can be life-threatening.
It can kill you instantly.
Yes.
That's another big problem. And if you look at it, it's the third commonest cause of death in the world. Is pulmonary embolism.
Amazing, yeah.
So it's a common condition, undiagnosed or misdiagnosis often. But essentially, what happens with the clot in itself is, one is it can go up, it can progress up to the lungs. The other problem is that if the clot remains there, it causes obstruction to the venous system, and your leg continues to swell. And the body does break up the clot with time. But it damages the valves are damaged. Okay. So in the long term, you're going to get chronic swelling, discoloration, and the picture that we showed earlier, where you can get ulcers in the leg.
And that's chronic venous insufficiency.
That's chronic venous insufficiency.
We have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Doctor, assalamu alaikum.
Wa alaikum salam.
Wa alaikum salam.
I would like to remain anonymous. I'm just asking something about blood pressure. I have 3 different readings, when I'm sleeping. I have a reading of 100/70. Sitting up a little bit later, I have about 130/90. And standing up goes to about 150/90. Is that normal?
Assalamu alaikum wa rahmatullahi wa barakatuh. Brother, there is a normal variation in blood pressure over the hours of the day and depending on activity. So you are right. Some people, when they stand up and they're busier, the blood pressure does go up. When they relax and sitting down, and when they're sleeping, the blood pressure does go down. But if your blood pressure should be checked to make a diagnosis of hypertension, should be checked when you're in a relaxed state, sitting down and relaxed. And then the doctor should check it once, and if he's still worried that you're a bit anxious, they should check it again. And if it's persistently high, that's the only time we would consider treating it. And depending on how high
I am on a blood pressure lowering tablet, on a daily basis, 5 milligrams.
So, I mean, it sounds like it's doing its job from the blood pressures that you've given me. And the one that's a bit higher when you're standing up may just be because you're a bit more active.
Okay.
And so I mean, your doctor will be able to give you more information, because if there are other signs that your blood pressure is not controlled, for example, you have heart disease or any other progressive condition, then sometimes they try to control it a bit tighter, But obviously, if your blood pressure is dropping so low when you're lying down, there's a risk it may drop too low, and you may get dizziness and so forth and so on. So I think rather consult your doctor. And if he's concerned, then there is something called a 24-hour blood pressure monitoring, which was mentioned by a patient earlier this evening, which they can do, which will give us a good idea of what your average blood pressures are and so forth and so on.
Thank you.
Okay, Jazakallah khair. So, Prof, we were discussing pulmonary thromboembolism and DVTs and chronic venous insufficiency. And maybe if we can put up the picture again of the venous ulcer that we had earlier, which can show what chronic venous insufficiency can actually lead to. The third picture that we had, and that was the one. That's the one.
This is a young lady who came to me with actually varicose veins.
Okay.
And gave her this ulcer, and this is varicose veins can also give you ulcers.
Okay.
But
because of pressure.
Because of the pressure that rises in the area, in the ankle specifically. But when we see this, we usually look at the deep system also. But often, the deep system is also not working well.
Okay.
And the cause for that may be DVT in the past.
Okay.
Or it may be just primary chronic venous problems. And this young lady has had her ulcer healed with the compression bandaging, and then we went and dealt with her varicose veins, and she's remained healed.
Alhamdulillah. With ulcers. We have another caller online. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. I'd like to know, I do have a few veins in my leg, and I developed cellulitis. I went to the hospital and they put me on very strong doses of antibiotics, about 4,000 milligrams a day. And I was on that dosage for 7 days, but it's 2 weeks now, but nothing has happened. There's no change. What do I do?
I think it seems very much like should be dealing with probably a chronic venous problems, because chronic venous problems can give you inflammation, which looks very much mimics cellulitis. And we tend to give antibiotics and it doesn't settle. The most likely cause for you is probably your veins. The valves are damaged, and what you need is proper compression stocking or compression bandaging, which should bring the swelling and the inflammation down. And then later you can have your veins assessed and then have them treated if we can sort that, if one can sort that out for you.
Are you at home or in the hospital, sister?
No, I'm at home at the moment.
Well,
I think the rule of thumb would be that if you're not improving, then go back to your physician
and see
and say, I'm not improving, please have a look again. And
maybe even what we call a venous scan may be helpful in determining what the cause for this inflammation is.
And make sure you don't have a deep venous thrombosis
as well,
which is another
possibility. No, they did do a scan. There is no thrombosis at all. Okay. But is it advisable to have more antibiotics?
No, I wouldn't. I wouldn't
without any specific evidence that there's a specific infection in that leg.
Okay,
so I think
what I would suggest is elevate your leg at night as much as you can. That will really help bring the swelling down. You can put some ice packs on it if it's hot and tender, and that will also help. And a short course of an anti-inflammatory, very short course, 4 or 5 days.
Okay. Do I need a prescription?
You will need a prescription. That's why I would suggest go and see your doctor again.
Okay. Jazakallah.
Okay. Jazakallah, sister. We're going to be wrapping up in a few minutes now, so I think we're going to close the phone lines now so we can just wrap up and try and sum up some of the things we've discussed and maybe complete the discussion. So we are going to close the phone lines now. But Prof, we were discussing the complications of deep venous insufficiency, and we showed that foot ulcer, and obviously that can lead to serious problems.
Yes. Look, the thing is that it depends whether you got primary venous disease or secondary venous. Primary venous disease would be varicose veins, where your valves are inefficient both in the superficial system and the deep system, or it could be alone in the superficial. The secondary cause is usually an old thrombosis in the leg, where the valves are completely destroyed and the veins have recanalized, they've opened up again through new channels,
don't work in the right way.
They're not functioning. And the treatment is really conservative. Get a good compression stocking and get the ulcer healed, or even compression bandaging, which is actually working very well. You leave the bandages on for a whole week and get the swelling down and the ulcers get healed. But if there is superficial and deep system, then treating the superficial system will heal the ulcer.
Inshallah. We're going to have to wrap up now, and just once more I'd like to thank Prof. Karim. Alhamdulillah, it's been a very informative show, and I think we could have another whole show and still not have covered everything. It's gone past so quickly. We'd like to thank all the callers for calling in, and once again, I'd like to wish all those who are suffering, who have got illness, we pray that Allah subhanahu wa ta'ala grant you shifa and grant you healing and make your recovery complete. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum. Thank you for having me.